folks, welcome back to another episode of the DrPH podcast. Today we have Emeka Iloegbu. He's a public health microbiologist and a laboratory epidemiologist with over 15 years of experience. Emeka has played a critical role in responding to health emergencies like H1N1, Zika, Ebola, COVID-19, and more. He's an assistant professor at CUNY, a leader in HIV research, and actively involved in global public health policy as a United Nations representative. Emeka's work spans from clinical labs to high-level global health discussions, and he's also a part of our very own DrPH program. That's how we managed to grab him here. Emeka, welcome to the DrPH podcast.
Thank you for having me.
You know, this intro I just gave on you, it's like me going into ChatGPT and saying, please only allow me to talk about 5% of who Emeka is. Yeah. And I'm saying that because it was an extensive 3-page list on the work you have done and the work you are doing. So I'm curious, first off, why did you even come to the DrPH program? What made you join a program like this for someone that has done so much outside of school already?
Yeah, that's an excellent question, and thank you for having me. Through my career and the work that I've been able to do, I will say I've been able to amass a lot of technical skills, right? And so you get to a point where you develop these technical skills in the different programs and trainings that I've been to, and then you apply it, and you're able to see the impact that your skills can have within an institution or a community. For me, making the decision to pursue a DrPH was based on my desire to work at the leadership level. And so I saw there were gaps within my ability to translate the evidence I was able to produce on the ground in the community or institution to changing policy, right? What does it look like to talk to a minister of health and to get their ear? What does it look like to talk to a dean of a school or talk to a faculty member, to understand the work that they're doing? How does it apply to the work that I'm doing, or to understand their motivations and understand where they are in their work and where I'm at in my work, right? So for me, being able to work at that leadership capacity was, I think, a reflection more of some of the challenges that I saw on the ground working within public health or working within the laboratory and seeing things that needed to be changed. And my technical skills can only take me but so far, right? And so pursuing a doctorate in public health, I'm passionate about the field, I'm passionate about the subject matter, and I'm passionate about it all, but also, being able to achieve a terminal degree in a field I'm passionate about. Of course, there's an energy there, right? And a desire there. But as it pertains to what I was really talking about, as it pertains to the technical skills and being able to, take on more adaptive leadership competencies, I think that was something that this DrPH program was able to provide me, which I'm able to get now.
I'm curious to know, so that's interesting. You're saying that you wanted to be more well-equipped for leadership roles. Where did your journey start in public health then?
I think this question has two answers to it, right?
Go for it.
Yeah, so my mom, she's a registered nurse, and so her first job in New York was as a public health nurse for the Department of Health. So in the early 90s, she used to do site visits in Queens, New York. And so I would be riding along with her, and I would see her go door to door, not knowing what she's doing. But I would see her dressed up in her nurse outfit, and she's talking to community members about health or what have you, not really knowing what was happening. And so I believe that at that point, there may have been a seed planted within my mind and within my development that was able to kind of cultivate and flourish through the years. And so I believe that it started then. And then fast forwarding, having graduated University of Hartford with a bachelor's of biology, a bachelor's in clinical laboratory science, I had working in a hospital. I'm at NewYork-Presbyterian Hospital. I'm working in a laboratory. I find myself most of the days staring into a microscope, looking at the cells, analyzing them, producing reports, sending them to the physicians and for them to be able to render a diagnosis. But then I had this desire within me to explore the world outside of this microscope, right? What lens will I use to be able to assess this world that I feel this pull towards, right? So then I started volunteering in New York City. This was in early 2008, 2009. And so around that period, being able to volunteer at the capacity I was doing, it led me to volunteer with the Red Cross. And so the Red Cross gave me all this training. And so it was an opportunity for me to give back to the city of New York in a way that I felt I could. And so being a trained first responder in the disaster reserve institute at the Red Cross, we were able to respond to a number of different health emergencies. The one thing that I found out was that in these communities, we were able to provide assistance, supplies, and resources, but I was asking myself some questions that I was not able to answer based off of the work I was doing with the Red Cross. How does a community come together to address some of the public health issues or some of the issues that stem from this disaster in a sustainable way? Because we were going back every day. We were providing water, we were providing paper towels, we were providing food and resources. And so that experience working within the disaster space for about a year or so led me into the public health field and trying to get answers to some of those questions. And fortunately enough, I was able to get some of those answers.
What made you start with microbiology? Did you and perhaps tell me that first, and I'm curious, there might be someone watching this where they're 16 right now, they're 18 right now, or they must have, finished a degree and they're interested in microbiology. What made you choose microbiology, and what even is microbiology?
Yeah, these are good questions. So it was a choice that was made during my undergraduate studies. I was getting towards my fourth year, completing my bachelor's in biology, and so kind of thinking about what type of career I want, what impact do I want to make, what direction do I head into. So around the fourth year, my university created a clinical laboratory science program. And so I was able to sign up for this program. I already had all the prerequisites, having taken a full course load in biology. And this new program, I was able to work in different departments: chemistry, immunology, hematology, microbiology, and so on. And so within this training program, I found a particular interest in microbiology. And so microbiology has a number of different sectors. We have bacteriology, there's parasitology, there's virology. And so for me, being able to understand how diseases manifest, but also some of those causative agents that causes disease, right? And so for me, being in a laboratory and being able to understand the characteristics of some of these microbes and how we're able to identify them in a timely manner to be able to render a diagnosis clinically, for me, that was something that really was an interest of mine. And so it's very practical, right? So it was I will say not so much a natural decision that I made. Being an undergraduate student, you're about to graduate, I need to find a job. My parents looking at their watch, okay, you're about to come out of school with your degrees, what are you gonna do with it, right? And so I think it was an organic manifestation in many ways of how I ended up in the field of microbiology. And so the interesting thing is that I started in laboratory, and I still do work in the laboratory from time to time. The public health field was able to allow me to build that bridge between working within a laboratory and using that knowledge of microbiology and some of these infectious states to then work at the community level. And how do you rally the community to design interventions that are able to address some of these pathogens that have caused a serious morbidity and mortality and sickness and death.
And what about the person? That's a very detailed answer, right? Like and it's very practical, like you're saying. You can kind of predict the future. You're looking at the future in front of you.
Yeah, in many ways. Yeah.
In many ways. What should someone know who is thinking about a career in microbiology before they join that?
If you're thinking of a career in microbiology, and you have to first ask yourself, what is your appreciation of science, right? And then also too, microbiology is such a vast field, and there's a lot of new developments within the field as it pertains to diagnostics and as it pertains to our understanding of the evolution of the microbes themselves. I think if you are an explorer, if you're a person who likes to delve in some of the more complex areas within the science field, I think microbiology is a place that is practical, of course. And there are a lot of theoretical concepts as it pertains to being able to predict the evolution of a microbe or how they are being modified due to climate change and some of those other environmental components. But for those who are, and I have students who ask me this all the time in trying to determine what route they should go, but ultimately see what draws you to that particular area, right? For me, it was microbiology. For someone else, it may be chemistry. For someone else, it may be immunology. And these fields are really detailed and they're unique in their own ways. But ultimately, if you are a student or someone who's looking to work within a hospital, or you're looking to teach, or you're looking to do research, I think those are some of the where the starting point should be as it pertains to what direction you want to head into and what impact you want to make.
This looking to thing you were mentioning, someone looking to do this, someone looking to do that. What was your looking to back in the day?
A lot of it was, I have a level of curiosity, I will say. As I mentioned, my mom, she's a nurse. My dad is, he's a chemical engineer. And so, growing up, my dad he would set the kitchen table up and he would create, one side would be a series circuit and the other side would be a parallel circuit, right? And so we would have to connect the light bulbs and connect the wires and then see which ones work. And so for me, it was always, I feel at a young age, there was this level of curiosity and trying to understand how things work and how things are connected and how do we build bridges between two parts that may be seemingly different, but there are elements of similarities that can be appreciated. And so I will say that these were qualities within me that were instilled from my parents that, I really give them, really a lot of credit in who I've become today and how it's really influenced my journey within public health and within the science field.
I love it. It started with your mom as a registered nurse. It all goes back to that.
Yeah, planting that seed. It's and it's tough. Both my parents are from Nigeria, right? And so they came to the U.S. My dad came to do his master's in chemical engineering. My mom followed with my older brother, and so they drove after my dad graduated. Drove from Iowa to Queens, and so just trying to make it work, right? I think the immigrant story is a story that has always been told, and so it's the children who end up embodying those stories, and it's becoming lessons learned. And so we want to, in many ways, do right by those who have come before us and the lessons that have been passed down. But then also we're also trying to find our own space, right? What are some of the things that I want to do as an individual, as someone who wants to make an impact in this life? And so, in Nigerian culture, they say, you're going to be a lawyer, doctor, engineer, right? And then so again, if you end up finding another profession that's successful, that's a box checked. But at some point, you have to then find out what is it that you want, and what is it that where do you see yourself in this life? Because at some point, I think the realization that your decisions are your own and the outcomes of those decisions are left for you to deal with, I think ends up becoming that defining moment as it pertains to, okay, no, this is what I'm going to do, and this is the reason why.
I love this.
Yeah.
You've done a lot of emergency response work and field work.
Yeah.
I'm curious to know the noteworthy ones that stand out to you right now, and how did they help you define your current why that got you to NYU?
I will say my time at the Department of Health here in New York City, I worked as a quality management officer, and so this was at the beginning, at the middle of COVID, and then and then we had monkeypox thereafter. Doing that work, I was going into that work with a lot of technical skills, and so having worked in a number of different hospitals in New York and working at different capacities, I felt that I can make an impact within this department that I was working in, at the Department of Health, right? Particularly the public health laboratory. And so I find myself with an amazing team, and we were doing amazing work, but it was a very chaotic time, very challenging time in New York City. And so, and to answer your question, more broadly, kind of thinking about how that experience, which was quite transformative, leading to my decision to come to NYU to do my DrPH, I wanted to make an impact at the leadership level, right? And so presenting ideas during leadership meetings or during breakout sessions, and kind of seeing that some of the ideas that were, in my opinion, I think well thought out amongst myself and my team, was hitting a wall. And so I couldn't see past that wall, right? What were the conversations happening at the leadership level as it pertains to the type of response we can have as it pertains to the communities that are being affected by these diseases? And everyone's here, on the same mission, right? And so I just felt I will say, a disconnect in some ways as it pertains to what my abilities were in being able to make an impact within this institution. And then so during that time, I was really reflecting on my work, reflecting on what I've done thus far. And so having this passion in public health and wanting to make an impact within public health, I saw that the work that I wanted to do as it pertains to empowering communities, as it pertains to strengthening health systems, at that leadership level, I was missing those skills, right? I was missing those skills. You tell me to identify an antibody that's on a red cell, okay, I can do that. You tell me to write lines of code in R, I can do that. You tell me, like, you're
Wow.
doing these things, but it was building consensus amongst leaders, right? How do you do that, right? Being able to develop national plans amongst other leaders, and that can then translate to a positive outcome on the ground. What does that look like? And then so I knew I needed more competencies. And again, all the schooling and programs, they just give you pieces, right? You're getting these pieces. I believe that it's life itself that tells you how to place those pieces to form that puzzle. And then so here at NYU, I'm getting all the pieces I need, right? And then so it's up to me to know how to apply those pieces and form it into something that can say, okay, this makes sense. I know how to use this, and I know the areas within the work that I'm involved in, on the type of impact I want to make, how that will translate based off of the skills I've been able to amass through the years.
How has that changed since you got here now?
I've had quite an amazing experience here. The DrPH program here has allowed me to really evaluate my experiences, redefine the lens in which I view my efforts and view the work that I've done thus far, but also truly understand on a global level really what's going on. And I think the opportunities that I've had to engage different UN officials and different leaders to see the type of decisions that they make and why they're making those decisions. The training I'm receiving here at NYU has made that a bit more clear in many different ways. And so it's now informed me, as I am stepping into this leadership space, how am I forming my own decisions, and what does that mean for those who are receiving it, right? And understanding both ends of the spectrum, because none of this is happening within a vacuum, right? A decision's being made, and there are people who are being impacted by it, even if you see it or not.
It's so refreshing to hear. You're kind of like a jack of all trades, the way you described it, and it's really refreshing to hear someone that's done all the specific work, if you will, before, and is now thinking of leadership after having an in-depth knowledge of everything. Usually, people are trained to do it the other way around, right? That we're going to start with leadership and then learn the skill, or find someone that you're taking it like in a building path.
Yeah, it's interesting, right? I think it's you also have to go through some struggle and fail a bit.
Yeah.
Right? So
Tell us a moment of any failures you had that you think has defined you in your journey.
one of my first public health projects was at the U.S.-Mexico border. I partnered with the organization there, and this was facilitated through a applied practicum experience as a graduate student. And so I was going into this project very confident and very sure of myself in many ways. And so working on this project, designing surveys, going out to the community, collecting water samples, doing all the things that we were doing, I felt certain about the work I was doing. I felt certain about the community's response to the work we were doing, but I didn't know how to measure the impact, right? And so I think for me, during that time, as I look back, there were many areas where I dropped the ball on, as it pertains to community engagement, as it pertains to what does it look like to incorporate the community's voice into the design of a public health intervention or a public health project or program. Going in with the mindset that, okay, I have this project all laid out. This is an amazing school project. This is an amazing opportunity. And you're going in there with that mindset. And then so there needs to be some level of reciprocation as it pertains to how you're delivering this project, and then how you're allowing that project to influence the choices that you're making um, within this really dynamic environment, and so for me, that project thing was quite reflective in how um, a young student who is green in public health but has a lot of passion can also see certain shortcomings in not being able to deliver an effective project or an effective intervention. And so you may build a really good relationship and there's lessons learned there. But ultimately, if anything's being designed, if there's a project being designed, it should be done in conjunction with the community. And so for me, that was a lesson learned. And then again, there's been other failures, right? Going through the rigors of academics, right? I guess this notion that, okay, you need to get all A's and excel, and that you need to have high marks, right? And so I've experienced certain failures in my life within the academic space, and then having to overcome that and still have the confidence to pursue other opportunities, right? And so I think for me, it's been quite, I think, eye-opening in many ways, what it looks like to persevere through times of doubt. And so me finding myself here at NYU and the doctorate program and all that I've been able to do, and being inspired by so many other people, different mentors, and getting lessons learned so I wouldn't have to make those same mistakes in some ways, right? So yeah, I a lot of what I've been able to experience, and then also now reflect on. I look back at some of those challenges, and it really informs how I am able to address some of the things that I need to do to be an effective leader within global health.
I'm so excited to hear about all your leadership endeavors going soon. You've been a part of 15 published journals or so.
Yeah.
Were they all within the same theme? Did they all change based on the work you were doing in the past 15 years? How did that change for you?
Yeah. So it's been quite interesting. Here at NYU, I have an opportunity to do research under Dr. Emmanuel Pepra, and a lot of our work focuses on implementation science. And so right now I'm the section leader for advancing evidence-based interventions for those living with HIV.
And implementation science is something that it's to make it's the science of implementing something in that environment.
Yes. So it's interesting. It's relatively a new field, and so one of the things that I mentioned about implementation science, it's about building bridges, right? And so we want to know that the intervention that's being designed is designed in a way that's intended for the community, that it's acceptable, that it's feasible, that it's appropriate, and it's sustainable, right? And so there's really a practice element to it. And so a lot of the work that we've been doing has been unpacking some of these challenges and the bottlenecks at the community level, and putting out evidence that is useful for researchers and practitioners. And so the publications that I've been able to be part of was not a solo effort, right? Definitely been part of amazing teams, individuals that are smarter than myself, a lot of skills. And so for me, it's being able to be part of projects that make a difference. And implementation science, as I mentioned, is a relatively new field, but there's a lot of opportunities, I think, for researchers and practitioners to utilize the evidence-based frameworks to address some of the more serious health issues at the community level.
How does one collaborate with people to even get into a journal? There might be a student that's never been a part of a journal, and how does one even start there?
I'm very new to the research space as well, and so I've always saw myself as a practitioner, and practitioners can publish journals, articles as well. And so for me, being partnered with a faculty member here, Dr. Emmanuel Pepra, but there's also a lot of other faculty who they're engaged in a lot of amazing work. And so if you are interested in a particular topic and you see a faculty member or another doctoral student or another master's student who's engaged in research and there's an opportunity to publish, I don't want to say it's as easy as sending an email, all right, but I think sometimes the challenge is finding the right words to say,
Yes.
being able to initiate that conversation. And so I've been fortunate enough to be part of an amazing team within the IC lab, and there are a number of different labs here at NYU as well. And so for those who are interested in writing and publishing, there are many journals out there, and there's many different formats, right? So you have the peer-reviewed journals where you're publishing papers and are being reviewed by a diverse set of authors. But there's also commentaries, there's also blogs, there's also other news outlets, right, that you can get your voice out there, right? So I really encourage students who are interested in publishing to just start writing, right? Write and save, and always revisit it. The other thing I tell some of my students is that all these assignments that you're doing, this is part of your portfolio, right? Do the best you can to save your work. I know after you graduate, it's like, okay, I'm done with all of this. I know there's there's memes out there where people graduating, you see them throw all their papers out the window, or, some schools where they have actual like events, right, where they all get together and they throw it like over a balcony and it floods with papers, right? And I'm like, look at all this work. Hopefully someone has it saved on a hard drive, but yeah, this is part of your portfolio, right? And so when you graduate, the papers that you wrote for a particular class or what have you, you can always go back, reword it, and it could be something that can be published, or it can serve as a foundation for future work.
So do the work in the area you're interested in. Find the person doing a journal, which
Yeah.
is the hard part, right? Looking for the person that's actually doing a journal,
Yeah.
and then contact them with your work and have a good pitch ready.
Have a good pitch ready. Yeah. And a lot of it too, be passionate about the
Yeah.
subject matter, right? I think it definitely will come off the pages for those who are reading it. That's the hope, right? But then, and again, we live in a time where, I will say people's attention spans are getting shorter, right? So if you've published an article that's maybe 6 pages or 5 pages, or if you've published a blog post or what have you, I will say the writing style that you choose and how you choose to write it, or the journal you choose to publish, is very important. All right. And so yeah, that's the one advice I would give, is like, just find a subject matter that you're passionate about. And writing is important, but also I'm a advocate of and one who promotes recording voice notes. A lot of my friends,
Nice.
I send voice notes. They'll send me a text, I'll reply with a voice note, right? So if you're on the train or if you're at home and you have an idea, record it, right? And so it could end up becoming a body of work that you can then consolidate into something that can be a deliverable.
You've been at the UN. You've been at the Department of Health.
Yeah.
I mean, the list is countless. What's currently happening in your journey, and what do you think is next beyond becoming the better leader?
There is a lot going on, of course, and so one of the areas that I'm focused on is strengthening health systems, really, to respond to reemerging infectious diseases, particularly as it pertains to the use of molecular diagnostics. And this goes back to microbiology for me. There's a lot of technologies out there, and so how are communities or how are health systems adopting these technologies and utilizing them? And we're seeing reemergence of cholera and some of these other infectious diseases, and so one of the areas that I'm looking to really just hone in on is that community component of strengthening communities, right? And community-based surveillance. What does that look like, right? And how do we find new terminologies for these things, right? Some communities using the word surveillance, like, okay, you're watching us, what's going on here, right? And there's a cultural competence piece associated with that. So for me, working directly with laboratories in country and looking at their health system, looking at the quality management component, looking at the relationship with the community, and how can we better integrate both of these systems. And when we talk about technologies and we talk about diagnostics, how are these technologies developed with the community in mind? Are we developing these technologies and then saying, okay, community, this is affordable now, use them, or do they have a seat at the table in being able to have their voice heard that can then be included in decision making, right? So the leadership piece that comes in with that is being the person at the table that can then open the door for the community to come in, right? And so I've been fortunate enough to be at the United Nations at some of these high-level meetings and just looking around and say, okay, where is the community here, right? And then so there are sessions where the community is invited in, and they have a seat at the table. They're called civil society, and they have their organizations, right? And so for me, having an impact in building that bridge between the health system and the community, and then if we're saying if the UN is the governing body that then facilitates a policy, or if another organization or institution is the one facilitating the policy, where is the community in this? Where is their voice in this? And so one of the areas that is a topic of discussion now, antimicrobial resistance, climate change. And so working within that nexus for me, I think is an area that I'm deeply interested in. And on the other side of that, in the IC lab, we're doing amazing work with sickle cell disease. And so within my journey and the work that I've done, it's been this, a lot of work within infectious diseases. And as I mentioned, antimicrobial resistance and all that. But the work we're doing with sickle cell disease provides another area for me, and that's the clinical laboratory hematology component. That then it ends up becoming, I guess, a happy marriage within my time here at NYU, where I've seen sickle cell disease in a laboratory. I've seen it in a microscope. I know what the red blood cells look like, right? But now within this space, doing research on sickle cell disease, having that opportunity to really see how does this translate to change in policy, for me is a really important area. So those are the two, I will say, the two big areas for me, and with a keen focus on vulnerable populations, because a lot of the policies are really not sensitive to the needs of refugees, migrants, and those individuals who find themselves outside of the benefit of these policies that are formed. And so as a leader, where do I see myself in making an impact in that, right? How strong will my voice be within this space, And so yeah, there's a lot for me as I reflect on all of this. And so there are things, of course, that keep me up at night, keep us all up at night if we're passionate about this, but also being very realistic in how we are placing our efforts. And, I'm really big on quality, all right? And if we're spending time on something, what is the quality of our efforts and our output? And so, yeah, I mean, these are big issues, but I'm very optimistic. I'm a glass half full type of guy.
Absolutely. You're not only quality, you're immense amount of quantity as well. I'm
Right, there's that. Yeah.
You're ready to add another page to that bio you sent me. And Emeka, I'm really excited for your journey. We're very excited to see what happens for you next, and I'm sure we're recording this in 2024.
Yeah.
And you will graduate around 2026, and can't wait to see what happens in your journey, and we hope to have you back on the podcast.
Thank you so much. I appreciate it.
Folks, that's Emeka Iloegbu, trailblazer, inspirational figure for us at the DrPH program. We'll put all the stuff in the description, and we'll see you in the next episode. Take care, everybody.